What causes arthritis? Arthritis is the swelling and tenderness of one or more joints. The main symptoms of arthritis are joint pain and stiffness. They typically worsen with age. The most common types of arthritis are osteoporosis and rheumatoid arthritis. Osteoarthritis causes cartilage to break. Cartilage is the hard, slippery tissue that covers the ends of bones where they form a joint. Rheumatoid arthritis is a disease in which the immune system attacks the joints. It begins with the lining of joints. Uric acid crystals which form when there's too much acid in your blood can cause gout. Symptoms. The most common signs and symptoms of arthritis involve the joints. Depending on the type of arthritis, signs and symptoms may include pain, stiffness, swelling, redness, decreased movement. Causes: osteoarthritis. This is the most common type of arthritis. It involves wear and tear damage to a joint's cartilage. Cartilage cushions the ends of the bones and allows frictionless joint motion. Damage can result in bone grinding directly on bone. This causes pain and restricted movement. This wear and tear can occur over a long time or may be hastened by a joint or infection. Osteoarthritis can cause deterioration of the convective tissues that attach muscle to bone and hold joint together. It can also cause changes in the bones. If cartilage in a joint is severely damaged, the joint lining may become inflamed and swollen. Rheumatoid arthritis. In this arthritis, the body's immune system attacks the lining of the joint capsule, a tough membrane that encloses all joint parts. The lining, also called synovial membrane, becomes inflamed and swollen. This can eventually destroy cartilage and bone within the joint. Risk factors. This include family history. You may be more likely to develop arthritis if your parents or siblings have the disorder. Your sex. Women are more likely than men to develop rheumatoid arthritis, while men mostly develop gout. Age. The risk of arthritis increases with age. Previous joint injury. If you have had a joint injury, there is a high chance of developing arthritis in the joint. Obesity. Excess weight puts stress on joints, especially on your knees, hips and spine. Obese people have a higher risk of developing arthritis. Complications. If arthritis affects your hands or arms, it can make it difficult for you to do your daily tasks. If it affects weight-bearing joints, it can keep you from walking comfortably or sitting upright. At times, joints may gradually lose their alignment and shape. Diagnosis. The doctor examines your joints for swelling, redness and warmth. They also check how well you can move them. Lab tests. The analysis of different types of body fluids can help diagnose the type of arthritis you might be having. These fluids include urine, blood and joint fluid. Imaging. This includes X-rays, CT scan, MRI. Treatment. The treatment for arthritis focus on relieving symptoms and improving joint function. Medication. Non-steroidal anti-inflammatory drugs can relieve pain and reduce inflammation. This includes ibuprofen and naproxen sodium. They are also available as creams or gels which can be rubbed on joints. Steroids. Corticosteroid medications such as prednisone reduce inflammation and pain and slow joint damage. Counterirritants. Some varieties of creams and ointments contain menthol or capsaicin. Rubbing these ointments on the aching joint may interfere with the transmission of pain signals from the joint itself. Therapy. Some types of arthritis can be helped by physical therapy. Exercises can also improve motion range and strengthen the muscles surrounding joints. Surgery. This includes joint repair. Joint surfaces can be smoothed or realigned to reduce pain and improve function. Joint fusion. It is used for smaller joints such as those in the wrist, ankle and fingers. It involves removing the ends of the two bones in the joints and then locks those ends together until they heal into one rigid unit. Joint replacement. This removes the damaged joint and replaces it with an artificial one. The most common joints replaced are hips and knees. You can reduce arthritis symptoms by using the following. Exercise. This helps to keep the joints flexible. Swimming is a good choice because the buoyancy of the water reduces stress on weight-bearing joints. Weight loss. Losing weight may increase your mobility and limit future joint injury.